exam-oriented clinical neurology. Yes, I feel it's a very much student-friendly book and a handbook, and written by Professor Sreenivas sir. This will immensely help all the students especially to learn the practical aspects of neurology. To know more about this book, we have author himself with us. So, sir, first question is, sir, why this book now? We already have so many books in the market about neurology. So, how our this exam-oriented clinical neurology book is special and different from other books? What's the purpose of this particular book?
Yeah, thanks, Dr. Kishan sir, for your wonderful words and nice introduction. First of all, I would like to thank from the bottom of my heart Dr. Kishan Rao and White Army Publications for readily accepting to publish this book, Exam-Oriented Clinical Neurology. You can see the publishers are White Army. In fact, I was very happy that Dr. Kishan Rao himself has come forward to write the foreword for this book. I don't know whether you're able to appreciate it. He has written the foreword for this book. Yeah. White Army Publications, I really owe to you a lot, sir, because everyone knows your channel, White Army. I think in India, probably yours is the most leading channel for MBBS students. You have more than 165,000 subscribers. That I think is really mind-blowing. That shows your dedication and sincerity in teaching students, in getting all the professors from the different parts of the country, asking them to come and give their lectures. And you keep consistency, you maintain consistency. I've been regularly watching your videos. You're uploading at least one video a day. So the consistency matters. So you've been consistent, your channel has become, I feel it's #1 channel for especially MBBS students. So that way, I think I'm privileged and honored to get my book published by White Army, right? And now coming to the question sir has asked, I have written a book already, Focused Neurology. This is published by CBS Publishers. In fact, CBS Publishers and JP Publishers are the leading medical publishers of India. But this book, which was my first attempt, deals more of theory in neurology. That means it's like, we have Harrison, we have Bradley, we have Adams in neurology. So all the chapters, I've taken some important points and I put in a question answer format so that it is easy for people to understand it. And this book is mainly useful for Viva, oral exams. After your theory clinics, you have orals in the afternoon. So this book is mainly useful for that. The second book he was talking about is that we had API, Association of Physicians of India. We have national conferences every year. Last time we had it in Ahmedabad. Next year we are going to have it in Delhi in February, where I'm going to give a talk on headache. There they asked me to talk on coma and brain death. I contributed a chapter that was published by JP. Now the question comes, why this book, Exam-Oriented Clinical Neurology? I've been teaching for many years. We have good books on theory, like Adams, Harrison, Bradley, and so on. For undergraduates, we have Davidson. We have few books on clinical neurology, like McLeod and Hutchison, but they are more concerned with elicitation of science, how we elicit the biceps jerk, how we elicit extensor plantar response. They are concerned more with the elicitation of reflexes. It's a ritual program going on. But once you elicit the science, it doesn't stop there. They'll ask you questions on that. For example, if you take internal capsule, the most important point for MBBS students, they'll ask you the blood supply of internal capsule. Then they'll ask the structures going to the anterior limb, genu, posterior limb, where the books may give just a passing statement. That's it. They don't concentrate. But in the exams, clinical exams, they concentrate. And second thing, Dr. Kishan Rao, sir, I think you'll agree with me. Writing theory paper is very easy. You write it here, somewhere, someone corrects in some other place. But clinical neurology, the examiner stands right in front of you, asking questions. We get a sympathetic surge, the flight or fight reaction. We have palpitations, we have sweating. Whatever is there in the mind also just flies off. Unless you're well prepared for your clinical exam, you'll have to cut a sorry figure. So you should be really well prepared to face the examiner in the clinical exam, because he's directly asking you questions, now pumping questions every minute. So you should be well prepared. Writing theory, I feel, is easy. You just write someone somewhere corrects, but here you're facing the exam. So you should be, you should maintain a calm composement, and you should be really good in your clinical neurology points. So that's why I chose clinical neurology, exam-oriented clinical neurology book. The second point is that I could have gone and on writing clinical neurology, a lot of points, but that is not my intention. My intention is to help students, especially MBBS students and all the undergraduate students like physiotherapy, nursing, dental, and paramedical courses to appear for the clinical exam in neurology confidently. So I have carefully selected only 5 chapters. The first chapter, if you see the table of contents, if you see the first chapter, I don't know whether you're able to see it. The first chapter is about history taking in neurology. So what all points you should ask in history taking. So history taking in neurology. The second chapter is general physical examination related to neurological examination. So neurological examination doesn't just stop with neurological examination per se. We have to assess the relevant system concerned with neurological examination. For example, if there is hepatomegaly, it can cause hepatic encephalopathy, confusion state. Abdominal examination is equally important. Excellent. For example, I can tell you, one doctor, neurophysician, made a breakthrough in a medico-legal case. A family of a few people, about 5 to 6 people, were slowly dying. They became unconscious, they were dying. They were taken to all neurologists, leading neurologists. They were examining only the neurology part. They couldn't arrive at a diagnosis. One good neurophysician from Andhra Pradesh, believe me, not neurology, was examining the nails, hair, skin and all. Nails, he looked at the white lines, what we call as Mies lines, and he made a diagnosis of arsenic poisoning and informed the police that this could be a suspicious case of arsenic poison. And believe me, the police investigated, it turned out to be arsenic poisoning, which was causing comatose state and death. So neurology examination does not pertain to neurology. You have to examine the relevant systems pertaining to the neurology, like the respiratory system, cardiovascular system, etc. The third chapter is the neurological examination per se, like what you go in order: higher functions, cranial nerves, motor system, sensory system, etc. But then if you see the books like McLeod or Hutchison or other books, they give only the elicitation of science. There's no background theory related to it. Whereas here I've given all the theoretical background of the neurology exam. For example, if a person comes in comatose state, we know that reticular activating system gets affected. Both the cortices should get affected for a person to lose consciousness. So I made all these things in the neurological examination. Then comes the actual 2 chapters. The 4th chapter is hemiplegia and stroke, and the 5th chapter is the paraplegia and spinal cord disorders. The 4th chapter, hemiplegia, is basically kept for undergraduates, MBBS, BDS, physiotherapy, nursing, and paramedical students, wherein they talk about hemiplegia. I've discussed all the important points of hemiplegia. Later on, I'll discuss some important points like rule of 4, rule of 17, and dates. I used a mnemonic so that you remember brainstem science. So this is basically used for MBBS students, especially concentrating on internal capsule, where they ask you a lot of questions. And finally, the 5th chapter is the paraplegia and spinal cord disorders. Paraplegia is basically kept for postgraduate students, and they are expected to know this cruciate hemiplegia, mirror movements, all the spinal cord syndromes, blood supply of the spinal cord, etc. So I have carefully selected only these chapters which are really useful for your clinical neurology exams, and I tried to make it concise but yet comprehensive enough for you to face the neurology clinical exams confidently. Those 2 days are a real nightmare for most of the students, especially MBBS students, the clinical exams. It could be medicine, it could be surgery, it could be OG, it could be anything else. Medicine is the most difficult, I feel, and of the medicine subspecialties, I feel neurology is the toughest. Over to you, sir.
Sir, what I feel looking at the book is, it's more of a more than 20 years of teaching experience is there. It is put into use in this particular book. You have, through all your vast experience in this teaching field, you have prepared this book, not just wrote it for the sake of writing a book, but from your vast experience, how the student, where the students exactly feel difficulty, where they go wrong, all those things you have taken into consideration, and accordingly, all in one type of book for practicals, including, like you mentioned, whatever is required in the case proforma, neurology case proforma, and related theory also, or they can read in one particular book. So, and as a value addition, what we have done is in this book particularly, we have given the links of all the video discussions by sir. Like we already mentioned, sir has already got a very famous YouTube channel, Sreenivas Medical Concepts. So from that particular channel, there are so many videos, hundreds of videos are the relevant.
There are 350 videos, yes.
350 videos are there. So from that, whichever is applicable to this particular book, the discussions, those links we have given here. If you just scan this, take your mobile, just take a scanner and scan that particular. For example, I want to see paraplegia. See, I've just scanned the paraplegia. See, it has gone to directly the paraplegia video by sir. All the discussions. So what you can do is first go through this book initially. You read all the theoretical aspect of that paraplegia. What are the case like how the case proforma should be? What are the relevant questions can be asked? How to answer everything? Then to make it a revision for yourself or to reassess yourself, you can go through the hemiplegia, paraplegia, and so many other videos are there. If you're interested, nearly more than 75 videos alone on cranial nerves sir has done. So that shows how vast is neurology. But same time, having said that, it can be learned only by a mentor like Sreenivas sir. Okay, neurology is not so easy to learn by ourselves. It requires a mentor. So, sir, what do you say about that?
Yeah, you're right, sir. Actually, when I was doing MBBS, I felt general medicine was the toughest. I thought general surgery was more like practicing, like a skill. The more you drive the car, the better you are. Like that, I think it was that. And gynec, I thought delivered not much there, but general medicine, especially cardiology, the systolic, diastolic murmurs, neurology, I thought these two were the most difficult specialties. And of all these subspecialties, I thought neurology was the toughest. So at MBBS level, everyone feels that neurology is the toughest, and it's a very challenging field. As you have rightly said, sir, I have started a book. I have limitations. No, I can't explain. I can just write, but I can't explain. But in YouTube, I can, with the diagram, with the cursor, I can go on explaining. Like Dr. Kishan Rao sir has said, I have uploaded 75 videos exclusively on cranial nerves, right from first nerve to the 12th nerve. It is the most comprehensive subject on cranial nerves anywhere in the YouTube channel. I don't think any YouTube channel has gone in depth of discussing all the cranial nerves with 75 episodes. The best part is the Neuro Ophthalmology and Neuro Otology. Of the neurology chapters, I feel Neuro Ophthalmology is most interesting, challenging, exciting, and most difficult to understand. So can I just take 2 minutes?
Please.
2 minutes, yeah. Especially the oculocephalic reflex. When you turn the head to one side, it's always known as doll's eye movement. When you turn the head to one side, the eyes goes to the opposite side. It is because when you turn the head to one side or you pour warm water, you are stimulating the vestibular apparatus on the left side, which goes and connects to the PPRF, right lateral rectus, right medial rectus, and the eyes goes to the opposite side. So to understand this, someone should teach you. So when I turn my head to one side, the eyes goes to the opposite side. Nature always tries to compensate. So front eye fields area number will try to put it back. You get nystagmus. That's why the name goes cold opposite, warm same. Another interesting talk about neuro-ophthalmology is the ocular tilt reaction. When you turn the head to one side horizontally, the eyes goes to the other side horizontally. But imagine you're going on a bike. Now you're tilting in one way, ocular tilt. So when you turn the head to one side, eyes goes to the other side. But when you tilt eyes to one side, the eyes goes to the opposite side like this. So when I tilt the head to one side on the left side, eyes goes to the right side. It is again by the same mechanism. It goes to the MLF 3, 4, 6 nerves. But superior rectus, superior oblique are connected from the opposite cranial nerves. So there is double crossing. So superior rectus, when I turn my head to left side, superior rectus, superior oblique. This side, same side, inferior rectus, inferior oblique, they go on the opposite side. So when I turn my head to one side, ocular tilt, the eyes goes to the opposite side. These are wonderful, fascinating mechanisms given in book. But someone explains like this, people will not be able to understand. But once you understand it, you will really enjoy clinical neurology, especially neuro-ophthalmology. Believe it from.
There are so many comments on our Vitamin channel, sir, on your videos particularly. they have said particularly, they mentioned openly that after watching Sreenivas sir's videos, I developed love towards neurology. I want to take up neurology as my career branch. I want to be a neurologist like sir. So that's the amount of what to say influence sir makes on students by his teaching skills and his dedication or passion for teaching, and so much of influence on students as well. So,
sir, in this book also, as you have rightly said, I made some mnemonics also. I made some laws also, rule of 17, rule of 4 also. I'll talk about mnemonics. This mnemonic, I coined it myself. Corticospinal tract, you have seen, when a person comes with hemiplegia, they have this kind of gait, they flex hand like this, they walk encircling. This is known as circumduction gait. Yes. Books give it circumduction gait, but what is the mechanism? When you know the mechanism behind the circumduction gait, you'll really enjoy it. Corticospinal tract, though it supplies all the muscles, it specifically supplies few muscles. I coined the acronym DATES, D-A-T-S, deltoid. So when the deltoid is affected, they cannot abduct. It will be adducted. So abductor is affected, they'll adduct. T is for triceps, so they cannot extend. So it will be flexed. E is for extensors of the wrist, extensors of the finger. So they cannot extend the wrist, it will be flexed. And finally, S is for supinator. So they cannot supinate, they'll pronate. So they'll come like this. Likewise, in lower limbs, HT. Dorsiflexors are affected, hamstrings are affected. So to clear the ground, they have to encircle and walk. So this is the circumduction gait. Books give circumduction gait, you see in hemiplegia, but what is the mechanism? This is the mechanism because it has got a proclivity for these muscles, DATS, deltoid, abductor, triceps, extensors of the wrist, extensors of the fingers, and supinator in the upper limb, dorsiflexors and hamstrings and hip flexors in the lower limb, you get this circumduction gait. Likewise, I made some rules. Rule of 17. We all know when the 7th nerve gets affected, face goes on one side. But there's a difference. 10th nerve, 12th nerve, 5th nerve also cause the movements to be affected. So there's a rule known as rule of 17. 12 plus 5 is also 17. 10 plus 7 is also 17. So when 10th nerve and 7th nerve gets affected, the movement will be towards the healthier side. But when 12th nerve and 5th nerve gets affected, they tend to push to the opposite side. So when they get affected, the movement will be towards the disease side. So in the exam, clinical exam, suddenly they ask in 5th nerve, where's the side, which side it moves, in 10th nerve, which side it moves, in 7th nerve, which side, you'll tend to get confused. So if you have a broad perspective like rule of 17, so now someone asks me, I can tell easily. Now 10 plus 7 is 17, so they move towards the healthier side. 12 plus 5 is 17 again, they move towards the disease side. And again, for remembering brainstem structures, very difficult. Again, I made a rule of 4, which is given in other standard books also. You have 4 cranial nerves in midbrain and above, 4 cranial nerves in pons, 4 cranial nerves in medulla oblongata. The cranial nerves which divide equally, the 12 into equal parts are placed medially. That means 3, 4, 6, 12. The cranial nerves which don't divide 12 equally, they are placed laterally. All the structures which start with the letter M are placed medially. M for M, that is motor tract, that is corticospinal tract, medial longitudinal fasciculus. You have the medial lemniscus, posterior column, and medial MLF, medial longitudinal fasciculus, which are placed in the center, and motor parts of the 3, 4, 6 cranial nerves. And all the structures which start with the letter S are placed sideways. Spinothalamic tract, sympathetic tract, spinocerebellar tract, and sensory parts of the cranial nerves. So if you have this brainstem approach, is very, very easy. I can tell where the lesion, whether it's midbrain, pons, or medulla. So you should have some kinds of clues. In fact, I wrote it in my preface. Doctor is like a detective. Okay. The history taking is like getting clues. The examination part is like investigation itself. So we're all detectives. Think you're a detective. When a patient comes with a disease, you think you're a detective and trying to solve the puzzle. Finding out, there they find out the thieves and the criminals. Here we are finding out the diseases, which are like criminals for us. We have to get rid of those. So, and always history is very, very important. I already quoted William Oster. You listen to the patient's history. He's telling you the diagnosis. You need not break your head what you're diagnosed. Just listen to your history patiently. He's telling you the diagnosis. In fact, history is known as his story. Just listen to his history, you'll be able to reach the diagnosis.
Excellent, sir. Sir, now the only question remains, along with that, sir, what I would like to add is, sir has given so many tables like this, so many useful tables, very important. All the contents are put into table format so that it's easy for quick revision, as well as all the information, you can get it in one place. So all the like spinal cord syndromes, maybe in one table, or all the differential diagnosis, how to make like by mechanism, with along with the mnemonics he has given in table format. So it's convenient for the readers to read in all in one place in one go, and quick easy for quick revision as well. So in that way, it's a literally it's a very exam oriented and very much convenient for the quick revision, as well as during just previous day of the exam, we just go through this, and you can directly attend to any
yeah, you have rightly pointed out, sir. For example, paraplegia, which is usually kept for postgraduates, 2 questions you can definitely expect. One, extramedullary versus intramedullary lesion, standard question. Second, differences between conus medullaris and cauda equina, standard question. So I made a table, got all the points, what are all the probable questions to be asked on this. I made a table, as sir has rightly said. I made a table so that it becomes easy. Likewise, when you take hemiplegia, usual questions are directed at internal capsule. So I made a separate subsection on internal capsule, so that any question on internal capsule you'll be able to answer, like gait, and even the other CT and MRI, the sequences, how you identify. In fact, I try to build up from the base level to a very high level, sir. So it will be useful not only at the lowest level of first year clinical MBBS students, but even for MD general medicine students. Even DM neurology students can have a peeps once or twice in this book. So
only one question remaining with all of us is how to avail this book, how to avail this book and make the best use of this book. So the answer is, we'll make it available on all the major online selling platforms like Amazon, Flipkart, etc. And for time being, if you contact me, I'll give my contact number here. If you can message me, I can directly courier it to you, okay, to your address. Also, sir has got a number of copies, so he will be attending many conferences and all. So in all the major medicine and neurology conferences, these books will be available. We'll make it available definitely. So there also all the postgraduates or neurology residents can avail this book and make the best use of it.
Sir, already what you have said has happened. One leading physician in Coimbatore has asked me how to purchase the book. I quietly gave your number, and I think he contacted you and got 3 books through courier.
Yes.
So easy ways to contact Dr. Kishan Rao, sir. Ring him up, you'll get the books.
Yes, thank you so much, sir. Any concluding remarks by sir? I feel really it's tremendous, sir. You are contributing this. See, we are not permanent, we are immortals. Today we are there, tomorrow we may not be there. But whatever these contributions you have made to the field of neurology, these are permanent, sir. See, so many books already. So yeah, so many books. So these are permanent. These are going to be there for ages, and the students next like generations will make the best use of these books. And I wish that you write many more books and many more editions to come, and hope I get the privilege to publish much more books by Sreenivas, sir.
It's my privilege and honor to get published by Vitamin, sir. Probably the #1 Indian neurology.
No, my only intention is to help the students, sir. If they are getting helped in any way, we are always ready to help them. I felt particularly, I myself have gone through this entire book. So I felt it's very useful and very valuable as well for any, not just for MBBS students, but also like sir mentioned, it will be, it's written in a very simple language that even a physiotherapy student or dental student, even a nursing student for that matter, can easily comprehend the entire neurology, the concept, whatever written here, and can easily reciprocate in the exam as well. So I just request all the students to make the best use of this book and keep it as a resource in your collection.
So one more advice I want to give, sir. What I've learned through these years is that you study from books, you see videos, you learn it, but only by sharing the knowledge, you gain knowledge. Because only by sharing, only when you start teaching, you know where you went wrong, where you could have taught better. So you learn by teaching. So always try to share, first try to accumulate the knowledge and try to disseminate the knowledge. This is the simple advice I would like to tell to the